Statins were, of course, designed to decrease cholesterol, but we've learned that they have lots of other, the so-called pleiotropic effects. They seem to reduce inflammation, improve endothelial function, and there's even a hint that they may have some effect on some cancers. The real question is whether or not these pleiotropic effects do have an effect on the atherosclerotic process or not. Now in JACC, there is an interesting report of a randomized study of high-dose versus low-dose statins to try and reduce the inflammatory changes of periodontitis, periodontal inflammation. They randomized patients to 80 milligrams of atorvastatin versus 10 milligrams of atorvastatin, and then did fluorodeoxyglucose PET CTs to see if there was a difference at 12 weeks in the inflammatory process. Not surprisingly, at the onset, patients with a lot of periodontal disease had a lot of targets that were exposed. At 12 weeks, patients who had high-dose statins had significant reductions in the target that was seen on the PET CTs compared to the patients that had only 10 milligrams of atorvastatin. What does this tell us? Well, it tells us that statins have an effect on inflammatory disease, and we know that periodontitis is a risk factor for atherosclerosis. It is possible that high-dose statins may have a better effect than low-dose statins on patients that have inflammatory changes and atherosclerosis. Interestingly, in this study, carotid inflammation also correlated with the decrease in inflammation in the periodontitis. So there may be some effect on vascular disease as well. I'm sure we'll hear more about this. It's an interesting concept, and the pleiotropic effects of statins seem to be real. For CardioSource, I'm Peter Block.